everybody up. And a reminder that this is an on the record.
Us today, as usual, we reached a peak of over 65,000 cases at the very beginning of January. You can see that we had dramatic drops and have plateaued and are starting to continue to watch. We are seeing the same trends in our percent positivity, our cases, and our hospital usage. Hence, that we feel may have an impact on our trends in Arizona that are overlaid in our communities. The dark portions of the bars represent unique patient tests. So those are patients that have only been tested once. The gray indicate those that are repeat tests. And then the red line is our percent positivity. And you can see over the last few weeks, we have remained relatively stable with our percent positivity. A quick look at our hospital usage. This is the number of inpatient beds that are being reported in use in Arizona by our hospitals. The light gray is the available inpatient beds. The blue are beds that are current in use by non-COVID patients. And the gold is beds that are in use by COVID patients. So you can see that that has been relatively stable over the last several weeks. Same with our Arizona ICU beds. So again, gray is that refers to beds that are currently available and unoccupied. Blue are occupied beds by non-COVID patients, and the gold is beds that are occupied by COVID patients. So you can see that that has remained relatively stable with a slight tick down in the last several days. And then we always look at our COVID-like illness, our syndromic surveillance, and you can see that that mirrors relatively well the experience that we've had with cases and with hospital admissions. And you can see that that continues to trend down as we move forward into the summer. So now I'll provide some updates on COVID-19 vaccine and the implementation of our vaccine program here in Arizona. Like I said, ages 12 and above are now eligible for vaccination in all Arizona counties. On May 12th, the FDA and the CDC recommended that Pfizer vaccine could be used in those that are 12 and older. The really exciting update is that the vaccine now may be co-administered with routine childhood immunizations or flu shots, without waiting for that 2-week period. If you've been vaccinated in the past, you probably got asked if you've had any other vaccine in the last 2 weeks. This will allow pediatricians to co-administer if kids are coming in for their child checks and it's time to get their routine immunizations. Pediatricians can immunize them with the COVID vaccine at the same time as those other immunizations. So that is reducing potential missed opportunities to vaccinate, and we were very excited about this news. Pfizer did announce that it will seek full approval of its COVID-19 vaccine, and that should include ages 2 through 11 by September. So we're anxious to include even more age groups in the eligibility. We have been allocated a projected total of about 6.7 million doses in Arizona. The doses are staying relatively stable after an uptick in March and April. We continue to offer that vaccine to our county health departments and our local allocators, and have made it eligible or available for providers' offices to order. As you can see, this is our vaccine administration dashboard. This updates daily on our website, and you can see that we've administered over 5 million doses here in Arizona. We have had over 3.1 million Arizonans who have received at least one dose, and so that's very good. We continue to increase the number of people who are fully vaccinated, but you can see, based on our vaccines administered per day graph, that we are seeing a decline in the number of vaccinations administered each day. On our dashboard, you can also look at the vaccine coverage by age, and so we've broken it down into age groups. We have vaccinated over 83% of those that are over the age of 65. And so that's a really good milestone, because we prioritized those individuals early on, and then also prioritized those living in long-term care facilities and our healthcare workers. And so it's good to see that we've got high vaccination coverage in that age group, because they were one of the age groups most at risk for bad outcomes. As of May 21st, we've had over 103,000 Arizonans between the ages of 12 to 18 vaccinated as we've continued to increase the age. We anticipated that approximately 385,000 Arizonans became eligible when Pfizer increased their eligibility down to the age of 12. We have over 1,600 provider sites that have received vaccine, and have over 300 locations that are currently offering Pfizer to age 12 and up statewide. We've got over 975 pharmacies that have received vaccine, and that was always one of our strategies. We know a lot of people seek vaccine and testing at our pharmacies. They're distributed all throughout the state. Many people have a pharmacy nearby, and this makes it more convenient to go get vaccinated. And we continue to work with our long-term care facilities, but a lot of them participated in the CDC Pharmacy Partnership Program, and we had over 1,480 long-term care facilities participate in that. We did add a very exciting feature to our Find Vaccine website. So if you go to azhealth.gov/findvaccine, it is now searchable by vaccine type. So if you have a 12 or 13-year-old that you are trying to find Pfizer vaccine for, you can go, I'll go back to this slide. If you see the little arrow that's boxed in yellow on the left, you can push that, and that will bring that toolbar on the left up, and then you can select the Pfizer. And so the image that we've shown you here is selected for all pharmacies that offer the Pfizer vaccine. They may also offer our Moderna and Johnson & Johnson, but they definitely have Pfizer. So you can search for a place nearby. As of May 17th, eligible providers may now order all vaccine types directly in ACES without needing an allocation from a local health department. We have made Pfizer, Moderna, and Janssen available to all providers. As of this morning, we've had 169 providers statewide order over 40,000 doses to provide a vaccine in their office. And our federal retail pharmacy partners, our community health centers and dialysis clinics also are vaccinating down to age 12 plus if they receive the Pfizer vaccine. We would recommend that you do check with the entity that you are planning on going to get a child vaccinated, just to make sure that they do have the Pfizer. As you can see, we are seeing a decrease in our demand statewide. And so you can see that statewide vaccinations at our peak had been between 60 and 80,000 doses administered per day. We're currently looking at about 20,000 doses per day being administered. And you can see the significant drop off at our state pod vaccination sites. And so over the last few weeks, we've seen decreased demand. At the peak, we were just at the state pod vaccination sites. We're administering over 20,000 doses a day. But as you can see, we are doing somewhere between 5 and 10,000 per day now at our state pod vaccination sites. Because of the decreased demand, we are going to start modifying some of our hours and our days of operations at those sites. We've taken a look at our most popular days and our most popular times and are making some adjustments. There will be no adjustments to Gila River Arena. That will stay open daily from 7 a.m. to 7 p.m. There are some construction projects going on. There's some blackout dates due to graduations this week. And so what we would recommend, if you're planning on walking into a state vaccination site, please check the hours and days of operations at those sites to make sure that they are open and when you want to head over to that site. All 7 sites remain operational at this time, and there are same-day appointments that are also made available. That is encouraged for faster visits and more efficient visits, but we can get you in and out pretty quickly even if you just walk into our sites. And you can still book appointments if you want that faster experience at podvaccine.azdhs.gov. It's quick. Our website has gotten much more user-friendly and much more convenient. We still have all 7 sites. You can bring others with you who need to get vaccinated. We do recommend, if you're bringing someone under the age of 18, that a parent or guardian has to be present with them in order to get vaccinated. And we would recommend getting vaccinated as soon as possible. All right. One of the exciting things that we learned is that in this week's MMWR release from the CDC, it showed that we have higher vaccination rates in our rural communities than other jurisdictions. We were very excited to hear this. We had already been recognized for our vaccination in our communities with higher social vulnerability indices than other jurisdictions, but it was good to see that our local health departments in our rural counties were recognized for their fantastic vaccination efforts. They looked at 7 rural counties. Their definition is a little bit different than our definition here in Arizona. They looked at our 7 rural counties and found that they had much higher rates than looking at other rural jurisdictions around the nation. Nationwide, most residents now have a vaccination site located within 5 miles of their residence. And so again, just expanding that availability and access to the vaccine. We are using some of that zip code data, and you can see that on our website to look at our social vulnerabilities in our underserved communities as we continue to look at our vaccine equity planning. At our state vaccination sites, we've administered over 1.5 million doses, and over 883,000 doses have been administered in Glendale at our state sites in Glendale alone. While they have been an important strategy for kicking off our vaccination efforts, it's just one of the many strategies that we have deployed here in Arizona to make access to vaccine as easy and as equitable as possible. One of our other strategies that we are looking at is our community-based vaccination events. We will be partnering with some of our community and faith-based organizations on events, and our local health department partners are also partnering. This weekend, we have a kickoff on our door-to-door canvassing and yard signs in Phoenix City Council District 7 and 8. The kickoff will occur tomorrow at Grant Park. There's a community event with different activities going on. Equality Health and Adelante Healthcare will be offering vaccinations in partnership with Arizona. That will be at Grant Park from 8 to 2. We will also be hosting a vaccine event with those same partners at South Mountain Community College tomorrow. That event goes from 8 to 4. There are free vaccines available, and we would encourage anybody who wants to get vaccinated in those areas to come on down and join us. We've been asked for some different types of communication tools as we've been progressing through the pandemic. We do have a provider communication toolkit that is on our website. This has English and Spanish tools to help support our healthcare providers who are talking about the importance of the COVID-19 vaccine with their patients. So there's a lot of resources that are available on our communications webpage. There's posters, there's ways to address misinformation about the vaccine. There are helpful ways to answer some of the most common and important patient questions, flyers that people can, that providers can give to their patients, telling them what to expect after getting a vaccine or what to expect at their vaccine appointment. and lots of different materials that our health providers can use. As we move more into our community-based and provider and pharmacy-based vaccination strategies, we want them to have access to the information so that they can provide appropriate counsel to their patients. We've also developed educational materials for youth and families. So we're working on a toolkit for messaging. Those are in development. We do have some flyers aimed at kids and their families now that the eligibility has been expanded down to 12 and above with the Pfizer. We also do have vaccine influencer videos and images promoting the COVID-19 vaccine available for download, and you can find that on our COVID-19 communication website. We're also requesting help in promoting our healthcare providers to become COVID-19 vaccinators. In order to do have to get onboarded either with the state or with a website that will help providers be able to order COVID-19 through ACES. All right, and a couple of other announcements. So we're working with CDC. We have to be fully vaccinated for their next school with other childhood vaccinations. This will make it easy. We do have state vaccination sites which we consent on behalf of the child. CDC's mean we have worked with our county health departments to make sure that and this is really important, eligible person against COVID-19. In the beginning, when vaccinating every single dose of vaccine, one of the things that we're hearing is that some of those, they might not have a use that same day for to extract just a couple of doses. Take that opportunity to minimize vaccine wastage, getting people vaccinated and preventing. We issued guidance for our fully vaccinated individuals, Johnson, or you've finished your second dose of the Moderna or Pfizer, and our activities without wearing masks or physically distancing, except in places where it's required after the travel, and they can refrain. We've seen a lot of local jurisdictions follow suit after CDC.
Okay, first up is Bud Foster in Tucson.
Hi, Bud.
Question for you. I have just two questions, quick questions. The decay phase. Do you agree with that? And why?
Be transmitted through the community. And so mask wearing will do. I'm a little hesitant to say that we're definitely there, but our data is
cases a day, according to we are in fighting this pandemic right now.
Need to increase vaccinations in Arizona, which is going to be one of the things that allows us to. They're a good sign. I don't know that we'll ever finality like influenza, but I think we're in.
Okay, we'll go to Max Gordon.
Start reporting on so-called breakthrough cases.
Just changed their definition of a breakthrough. So we're
has been vaccinated and then also caught the coronavirus.
I know we've had.
How worried are you about mutations that may
Always a worry. We know that viruses mutate. That's what they do. But there is always a chance that it could mutate, which is one new case. There's you're just furthering the ability of.
Did you see any effects?
See, in the past, is it usually takes about 2 weeks from the implementation, starting to see if there were any effects next week, or.
We also run such clinics for the other, routine childhood vaccinations. In other words, can you go to a state site somewhere and also get everything else you need to get back to school?
So right now, those are usually handled either by our local county health departments, childhood providers, or pharmacies can provide.
Talking this week about boosters. We had our first vaccinations administered in January. It's the 21st of May. You're still trying to get first shots into arms. What are the plans that you're making as far as booster vaccinations and getting the first folks re-notified, perhaps?
Yeah, so what we are anticipating, the data shows that the vaccines are effective for at least 6 months. And so we would likely, and when boosters will be needed. By that time, what we would hope is that we would have enough capacity in the state where people would be able to come back and get that booster when they become available. But right now, we don't have any more information on when those boosters will be necessary.
from 20,000 vaccinations a day down to 8,000 stateside, similar stuff statewide. We're getting into perhaps the vaccine has said that the vaccine, quote, by the way, I've been told kills lab animals, isn't fully safe, still in the experimental stages, and said people are being treated like guinea pigs. These are his words. So tell me your reaction and how do you deal with that? I know it's a political question.
No.
I'm sorry.
I would say that unfortunately there is a lot of misinformation out there about the vaccine manufacturing process, but they still did the same clinical trials. So we've administered in real world studies to be highly effective at preventing hospitalization and their healthcare provider or about the COVID-19 vaccine.
Appreciate what you say about clinical trials, but EUA is not the same as full
FDA approval by September.
And in the meantime, everyone says this is an experimental drug. It brings us back to where we started. How are you going to get people to come in when at the moment they're being told, well, it hasn't been fully approved, but trust us. We're from the government. We're here to help you.
And I think that goes back to, why we're trying to provide our healthcare providers with toolkits, with information on how to address some of that misinformation. This is a quick approval method, but it does not mean that for those vaccines. And so really just trying to make sure that we're out there with the correct information things through the pandemic that
differs from full authorization.
Yeah, so for a full approval or full licensure allows it to be approved while they're going through the full bureaucratic process of becoming fully approved. And so but the safety and efficacy trials were followed as they would for any other vaccine or drug or test.
Correct.
Thanks, Al.
Thank you so much for taking the time. So I actually wanted to go back to the vaccine wastage.
Mm-hmm.
So we've seen a lot of now smaller local counties have their hands on Pfizer and might be using it for mobile pop-up clinics, which they may not have done before. So I kind of wanted to know how big is the issue of vaccine wastage with Pfizer being applied in these local places?
Yeah. So I don't have exact numbers for you. I don't know that our smaller providers and our local public health departments have had time to fully have wastage and report it. Now that we've got more supply than demand, that we had almost no wastage of the vaccine. Now we'd like to minimize wastage, but not at the expense of getting somebody who is present in your office in front of you vaccinated. And so we are encouraging people, try to find uses for if there are a couple of doses remaining because you had to open a vial, but don't hesitate opening that vial because you're not sure if you will be able to use all of the doses in that vial, because vaccinating that's the urgency right now, is to get as many people vaccinated as possible.
And then my next question is on the actual administration of J&J. We saw that after it was kind of put off the shelves and then put back on, people were kind of hesitant to get that shot. Have you seen kind of a change in that? Are people now kind of maybe forgetting or deciding that the J&J is now more of an option than it was a month ago?
Yeah, so we are hearing that more providers are looking at using the Johnson & Johnson. I think it will be offered at some of our events this weekend. And so we are seeing more acceptance of it anecdotally. I'd have to take a look at the data to see if the data matches up, but we are hearing less hesitancy about the Johnson & Johnson vaccine.
And why do you think that is? Is it just time? What do you attribute that to?
Well, I think whenever there's an announcement that there could be a serious side effect or bad outcome, and that it's being looked at, I think everyone just kind of stops and wants to hear what the findings are and what the recommendations are. Once the recommendations, vaccine overall is very safe. There were a small number of bad outcomes or occurrences, But in general, the vaccine is safe. A lot of people prefer that one dose of vaccine versus having to come back and get a second dose. So I think that could be driving that in.
For healthcare providers to kind of sign up and be able to administer the vaccine. But I've heard that there's still some barriers, especially for smaller health providers or doctors' offices. What can they do to try to go through this process and be able to administer it?
Yeah, so they can, on our website, we have links to how to become an onboarded provider. And our department will help walk through providers that may need some assistance if they have trouble questions. There's still going to be the barriers of, some of the storage requirements and then some of the sizes. So if a small practice who primarily treats pediatrics wants to provide Pfizer, we're still getting the big number of doses. Like you still have to order that 1,140 doses. There are some county health departments that are working with providers to potentially give them lower numbers of vials through them. So that would be a potential option. But we are hearing that they are going to reduce the number of vials and reduce the minimum order so that we can reach more practices. And so we would just encourage, work with your local health department or work with our immunization office. If you want to be onboarded, we'll help you through the process and hopefully be able to get you that vaccine pretty quickly.
Thank you so much.
Okay, Peter Samwer.
Hi, Peter.
Oh,
there you are.
good morning, can you hear me?
Yes, I can hear you.
Very good, thank you. I'm on a different computer today. So here's a basic question. When will the pandemic end? Meaning, what kind of declaration will it take for an end to a pandemic?
Oh, goodness. I would hope that the pandemic could end soon. I think everyone is watching what's going on in India and what occurred in Michigan with a little bit of interest before starting to make some of those big recommendations and announcements. We're still getting numbers of COVID cases reported each day. We're much lower than we were in January and February. I think we're kind of watching to see what the impacts of some of these new recommendations and requirements are before making a formal recommendation. But I think we're definitely closer.
So the pandemic obviously is global. Is there a certain percentage of cases that need to be reported worldwide by each?
Arizona specific, I think, I don't know what it would take for like the World Health Organization to declare that the pandemic is over, or for, the CDC from a national perspective. It does look like all of the states are heading in the right direction based on what I've seen and heard over the last few days. But I think with what's going on in some, like when you watch what happened in India and when you watch what happened in Michigan, I think that there's a little bit of hesitation because we've seen surges come back before officially declaring it over. But I don't know what it would take for a worldwide pandemic to be ended.
Good to know, sooner rather than later, we hope. A couple other questions. Do you have an update on how the variants are affecting us in Arizona?
So we are seeing increased numbers of the variant, specifically the UK. We've seen numbers of the other variants for more and more of the cases in Arizona. We've been staying relatively stable with our case counts and our hospitalization. So it's hard to say what specific impact that variant is having on our cases as a whole, except that we are seeing more of it.
Right, because maybe 500 or 600 cases a day. So I guess, would you say the impact is minimal at this point, or based on the numbers, or would you not assign an adjective to it?
It's hard to assign because I don't just say. I would imagine that it's having some impact on the number of cases, but again, we're not seeing huge increases in hospitalizations or deaths, just like you said, and our cases are staying relatively stable. So it'll be interesting to see how the variants change and then how that changes each of those metrics that we watch.
When you mentioned earlier, demand for vaccinations is dropping.
Yeah.
What's been the response so far on kids getting vaccinated? Has their demand dropped? I know we've only been doing this a little more than a week as a state. for 12 to 15-year-olds, but is their demand dropping or is it spiking right now?
So we started vaccinating them last Thursday. We did see a pickup in first doses, and I think we've vaccinated, hold on, let me see if I can find that. We've vaccinated over 100,000 individuals between the ages of 12 and 18. I think they gave me, let me just, I'm going back to my, I don't want to make it up. We can get you that number. They did pull it. I thought I had put it in my notes, Peter, so I apologize.
No problem.
I want to say it was like
okay.
or between
Sounds
12
good.
and 15.
Okay, yeah, I'll just wait for a text from Steve, that's fine. And then lastly, you mentioned hours being modified at state sites. Any set date on the mass sites for the state to close? I know obviously state.
What that would look like, what we're trying to identify, we definitely had wanted to wait through that next eligible group, those 12 to 15-year-olds. And so now that we've kind of seen that didn't, we were hoping we'd have a huge like rush on demand. We did for all doses, those types of things in the future, but right now we don't have any solid plans.
Very well, thank you. Have a great weekend.
You too.
Stephanie Innes.
Hey, Stephanie.
Shifting its strategy in terms of vaccinating the population, given that there's been a decline and maybe there's populations that you aren't getting?
Yeah, so that's a really good question, and that's always been which people were willing to do when there was less supply and a huge demand for it. We do know, though, now we have to make it more convenient, and so we are looking at a neighborhood vaccination clinic at Greenfield Elementary in the Roosevelt School District. And we vaccinated almost 700 people just in a couple. We know that taking it to people and making it more convenient is going to increase access and increase people's ability to be vaccinated. So you're going to see us start to do more of that, like it's doing more and more of those events moving forward.
Okay, thank you.
Craig Smith in Tucson.
Hello.
Hey, Doctor, thanks for taking some time for us. Going back to the idea of the boosters, and it does sound, are we looking at mass sites or is it more likely to be at the doctor pharmacy level?
It would be more likely to be at the doctor and pharmacy level, just very similar to how people access their annual flu vaccine. And so that's what we would look at on. But if there was a huge demand with a huge increase, we can stand up mass vaccination sites in just a couple of days if necessary. So that's always an option on the table. But we would anticipate by that time, providers wouldn't need to be pandemic providers in community health centers and those types of things. So we would imagine that it would be more like a flu vaccine distribution at that point.
And on the vaccine hesitant and any of those other kind of non-medical incentives?
So we may see more and more of those opportunities coming up.
Can you be more specific about what kind of incentive you're thinking about?
I don't want to take on. So one of the things that we're doing is we're partnering with the Diamondbacks to offer a vaccination day. Or an event where people can come out to Chase Field and get vaccinated, and then there's going to be events for kids and those types of things, and then they'll those that get vaccinated may get a free ticket to a future game of.
Anything contemplated for Southern Arizona, Tucson area?
We continue to work. That's the first one that we've gotten into with the.
Second.
I'll apologize to the Diamondbacks too if you.
Okay, I feel bad. I usually try not to trump other people's announcements.
That'll be my bad.
Okay. We blame Steve.
Okay, Katie Davis Young.
Lottery systems now. I've also heard of other states that now that they're vaccinating younger teens are coordinating with school districts and going directly into.
Yeah, so our local health departments have been working with some of the school districts to offer events, vaccination events with those school districts. I know the one that we held last week was highly successful, and we're looking at partnering with the Roosevelt, the one on school districts to get it closer into those areas, especially as we're moving down into the 12 to 15-year-olds.
500 or so cases per day. That's still a ton of people getting infected every week. What's it gonna take to bring that plateau to a full decline?
I think it's going to take a lot. We just have to get as much of the community as possible vaccinated. That's really what's going to bring that decline. So it's really working on getting into those communities, talking to people about the vaccine, and increasing those vaccination rates so that we can reach that herd immunity.
Do you have, if you could speak directly to someone in Arizona who is eligible and has not been vaccinated yet, what would you say if you were face to face with someone who was hesitant?
Oh, goodness. I guess I would ask them why they were hesitant and then try to address if they knew what that specific hesitancy was about, because there's a lot of reasons that people are hesitant, either just about the COVID-19 vaccine or all vaccines in general. But what I would say is that, a lot of people don't feel that they're at risk from COVID because they're either young, they don't have medical conditions, and really, the best way to protect yourself, but also your family and those you love, is to get vaccinated, because you're less likely to get infected with COVID-19 if you have it. You're less likely to transmit it to others if you are vaccinated. And it has a really good efficacy for preventing hospitalization and death. So really trying to protect those that are around them and trying to play it off of that. The vaccines are safe. We know that they're effective, and it's the best way that we're going to get back to normal without having the fear of infecting somebody who could be hospitalized or die from COVID.
Thanks.
Welcome.
Our last question is from Liliana.
Hi, Liliana.
Hi, Liliana with Univision. So I read a report about going back to the mask situation. With the lifting of these mask mandates, the younger folks, children can be infected. What do you have to say about that? And should children be wearing masks still?
So what the CDC is recommending is that masks in schools and masks for children are still an important mitigation strategy. Many children have not been made eligible to be vaccinated just yet, and they just recently did the 12 to 15-year-olds. So we know that they are not fully vaccinated because they've not had the opportunity to get both doses of Pfizer and then have the 14 days. So we would still recommend, if they are with people that they do not live with, that they wear a mask when they're out in public. That's them.
Okay, and with that,